Hello, my name is Brandon Hahn. This is Abnormal Psychology. This is my third attempt at trying to make this video. Unfortunately, my laptop was being uncooperative and these MP3, MP4 conversion files not making a whole lot of sense to me. I'm not very tech savvy, but I'm now on my iPad, and so let's do my best to get this posted tonight, and hopefully I won't have any more issues. So the third time's a charm right here. So without further ado, this is my patient. Our patient is a 23-year-old white female that goes by the name of Betty Bishop. She presents to my clinic with short black hair, which is very neatly styled, while wearing moderately inappropriate clothing. Patient appears to be well groomed and maintains an average BMI. Patient presents with several visible tattoos and bracelets to cover up several scars on the interior aspects of her wrists. Our client claims that she was sexually abused at the age of 10. She has a family history of alcoholism on her father's side and clinically diagnosed anxiety on her mother's side. She is the younger of two children. Her older brother, who is currently serving a 5-year sentence in jail for assault and battery charges. I'm sorry about that. She was born and raised in Las Vegas, Nevada, and moved to Denver, Colorado at the age of 18. She describes her childhood as at times harsh, although with moments of neglect and absence of care. She moved out of her parents' house at the age of 16 after becoming pregnant with her high school sweetheart's baby. After the child was lost during a miscarriage, she claims that her boyfriend blamed her and beat her. The young man was arrested by the police, and Betty spent the next 2 years working at various diners as a waitress. After moving to Colorado, our patient has worked several jobs, including cashier and receptionist. She describes herself as having difficulty holding down jobs for long periods of time. She has little to no contact with either parent and hasn't spoken to her brother in 5 years. She is recently divorced after 6 months of marriage, which ended due to infidelity and domestic violence. Patient was arrested by the police 1 month ago on charges of possession and domestic abuse. She has not yet completed high school. However, she states that she has desires to attend a community college. One of her interests are helping others with addiction problems and helping those who have lived a hard life. She does not have any special training and currently works as a receptionist at Comcast. She states that she is a social drinker who typically drinks about 8 to 12 ounces of alcohol a night. She admits to using cocaine and marijuana. She is currently awaiting a hearing for her disciplinary problems, and she states that she wants to get help for her behavior. Other than minor car accidents, patient has sustained no major injuries, and her hospitalizations mostly consist of an overdose and a laceration to the head back in 2012. Patient has no history of psychiatric hospitalizations or admissions. She is currently living with her male friend, which she describes as the only person who ever really cared about her. Miss Bishop's main method of transportation is public. However, she constantly gets rides from friends. Her daily activities include hanging out at the bar, where she feels wanted and adored. This is her second shot at seeking psychiatric and psychological help. Patient states that she often makes impulsive choices, which later she regrets. She describes her relations with others as unstable and has trouble maintaining long relationships for long periods of time. Patient describes herself as being very sexually active and attaches quickly to members of the opposite sex. Betty brought up several times during the course of our initial interview that she often feels ugly on the outside and on the inside. Patient has intense fears about being alone and abandoned. She also states that she often has trouble concentrating due to her anxiety and depression. Miss Bishop describes her moods as being an ebb and flow model, with great highs and great lows. She feels as though she can be very level-headed at times. However, when things go wrong, she states things go very wrong. She often has thoughts of self-harm and suicide. She currently states that she has no suicidal ideations or intentions of self-harm or harming others. She states that she thinks about suicide 4 to 5 times a week, and mostly at night when she's by herself. Betty has described herself as being an outsider and has trouble relating to people around her age and socioeconomical status. She has trouble paying the bills and explains that her debt is currently spiraling out of control. Patient has trouble sleeping alone with about 3 to 5 hours average of uninterrupted sleep per night. Patient has trouble, patient, Miss Bishop related to me that she doesn't have a problem with her diet. However, food is very expensive and she often forgets to budget for meals. Patient's current medications include Zoloft 100 milligrams for depression and 1.5 milligrams Xanax as needed. She states that she is currently seeking help to make the emptiness go away. After interviewing and reviewing the DSM-5, I have come to the conclusion that this patient's diagnosis would be borderline personality disorder, with maybe some secondary diagnoses such as an anxiety disorder or depression disorder, but mostly borderline personality disorder considering the demographics of this patient. Some of the current strengths that this patient's going to have is she's very socially competent and displays a moderate level of manipulation. Her personality presents as charming and normal in demeanor. One of the greatest weaknesses that this patient is going to face is unable to maintain long-term relationships due to her self-destructive nature. Patient is prone to drug and alcohol addiction as well. One of the main challenges that we're going to face with this patient is her continuity of care and getting this patient to show up for therapy, whether that be once or bi-weekly sessions with me or a once weekly session with a group therapy. My proposed method for treatment would be mentalization-based treatment therapy. Here we will help Betty interpret her actions and break down day-to-day behaviors and use reflection technique to help her see the error in her ways. We will also help her interpret the actions of others and how she could better react to situations. Our goals with this treatment are to see Miss Bishop have better behavioral control, maintain more intimate and gratifying relationships, and help her pursue lifelong goals. A second option for therapy, which has additional benefits, is the dialectical behavior therapy, also dubbed DBT. It's a therapy designed to help people, or in this case, Ms. Bishop, change patterns of behavior that are not effective, such as self-harm and suicidal thinking and substance abuse. This approach works towards helping people to learn about their triggers that lead to reactive states and helping with coping skills. In DBT, we assume that people are doing the best that they can. However, they lack the base knowledge and the base skills to reinforce positive or negative behavior that would interfere with their ability to function in normal society. Both methods have a moderate amount of self-reflection-based therapy. This has both a very positive appeal and a very negative appeal to it. One of the positive notions is that the patient will be willing to see the change and potentially see the error in her ways. A very negative aspect of this, though, could be the fact that due to her already low self-confidence, she could become very suppressive in nature and veer away from treatment, whether that's group therapy or whether that's also one-on-one therapy sessions. My choice personally for this patient would be DBT therapy. It may be the best option for her due to her self-harm, both physically, her want to self-harm both physically and mentally. The cuts on her wrists indicate that she is maybe prone to self-mutilation, and thus DBT may be the more effective method here. In pairing this patient with one of my colleagues, Dr. Anderson, a local psychiatrist, we can continue to treat depression and anxiety via means of medication. If the patient truly desires to truly change her ways, then it would be very possible for her to see a positive prognosis in this patient. Ms. Bishop could greatly benefit from two different types of therapy. one with myself performing psychotherapy once a week, while she also attends a group therapy session. This group therapy session could potentially lead her to realize that she is not alone in this world and display how to have meaningful and gratifying relationships with others, much like herself as well. Different tasks for this patient could include keeping a journal of incidents that occur both in her professional and in her personal life. Upon group therapy or individual therapy sessions, we can analyze these situations and we could see how to improve or better improve that situation. Keeping the subjectivity out of the equation could also be very important to Miss Bishop. One of the things that we would like to see happen with this patient would be to write her thoughts down on a sticky note before they become verbalized or before they become action. This would essentially take the subjectivity and the emotion out of the equation, thus allowing her to have a more objective and emotionless or less, illicit response to anything that she may experience in day-to-day operations, both professionally and personally. Lastly, teaching this patient how to self-soothe. This could be helping to find this. This could help her find this patient find a new hobby or find new positive means of gratification. It could even be listening to music or playing a non-violent video game. This patient could greatly benefit from both psychological and psychiatric help.